Good morning, students.
Can you see the screen?
Yes.
No, we will wait for 3 minutes and then I will begin. Что это? You see that this is the first lecture devoted to inflammation. And there will be 3 lectures. So today is the first. And it is devoted to vascular reactions. So we will begin. At first, definition. What does it mean, inflammation? It is a typical pathological process, non-specific response to injury in the cells or tissue injured by but stay alive. You must understand this. If there is dead cells, there will be absence of inflammation. You will find only the feature of necrosis. Clear? Why we told about typical pathological process? It means that such inflammation, such process appears in all animals and in human being, and it will be not depend on the cause which is initial for injury. And that is why they told about non-specific, means doesn't depend on the cause. What are the signs, the main signs of acute inflammation? They will be redness, local heat, swelling, pain, and loss of function. Now this is the funny picture which show you all the cardinal signs of inflammation. And all of these lead to this one, the loss the function. Causes of inflammation. No, there will be all factors which lead to injury, cellular injury or tissue injury. Yeah. But you must understand there will be exogenous, no, it is clear for us, and endogenous. And what in endogenous, you must remember on previous lecture, we told that the cell must be injured if in the cell is disturbance or impaired homeostasis. That is why metabolic disbalance disturbance of homeostasis. You see, any immune disease may lead to inflammation. The main components of inflammation, they are blood vessels, leukocytes, and component of plasma. What will be the outcomes of inflammation? No, one is clear, maybe complete restoration. That is why healing. Yeah? Sometimes it may be chronic inflammation. The outcome from chronic inflammation may be healing or death. You see, one type of chronic inflammation is granuloma formation. And in this case, there may be healing too. Healing or death too. No, as I told you previously, inflammation includes cellular components. Which cells take part in inflammation? Now you see, due to this picture, approximately all blood cells. They will be neutrophils, monocytes, eosinophils, T and B lymphocytes. You see, approximately all cells. As for component of plasma, what do you think? No, at first, there must be complement system and such factor, Hodgman factor, which are in blood. And you know that Hodgman factor, or in another word, it is 12 fragment of clotting system. And you see, Hodgman factor not only activate clotting system, but anti-clotting system, complement system through the alternative activity, and kinin system. As I told you previously, there will be reaction of vessels. What this is the changes of blood flow in microcirculatory vessels, means the change reactions of vessels. If there is injury, at first you will see the short duration spasm of arteriola, and that is why if it will be in skin, you will see the white line or white region. This white region very quicker, in seconds, turn into redness, and there appears arterial hyperemia. Arterial hyperemia appears when the microcirculatory vessels dilate. Increase both arterial and venous. There will be increased blood flow velocity, increased number of functional capillaries, increased permeability, increased lymph flow, increased hydrostatic pressure in capillaries. But pay attention, there will be increased lymph flow, and that is why there is increased permeability, means some fluid comes from the vessel into interstitial space, but as there is increased lymph flow, all this fluid return back, gathered from the interstitial space, and return back into venous vessels. Further, there will be venous hyperemia, or in another word, congestion, it will appear after some time period. There is a time period from arterial hyperemia to appears venous hyperemia. And this will lead to further dilation of vessels. This will decrease blood flow velocity. And if that's so, there will be increased viscosity of blood. Further, increased permeability, which lead to formation exudate in interstitial space. And the last will be stasis. Stasis means stoppage of the blood flow in the region of inflammation, not in all vessels. You see? No, this is for you remember, because previous lecture you received such information about this. No, this picture shows you that these changes of vessel reactions in the region of inflammation, not in all cases will be that I described to you. Here there is a furuncular. This is the inflammation here in skin. And what you see here, you see that all these reactions, vessels reactions, in one time you can see here. So in center there are purulent, means the dead cells. You see what? And absent of blood flow means stasis. This white spot is surrounded by venous hyperemia, and outside of this region is arterial hyperemia. Another example which show you that there may be except of these vascular reactions. For example, if the injurious agent influence on the skin or mucous membrane not quicker, such as, for example, fire. You see, if there will be fire, you will find in skin or in mucous membrane, the first there will be arterial hyperemia. Further, you will find blister. You see, there will be absent of transitory spasm, and further they will appear as venous hyperemia. This is the picture which shows you the changes in microcirculatory vessels during arterial hyperemia. This is a question in colloquium. You must give the explanation of redness in the means arterial hyperemia in the region of inflammation. What will be the answer? No, at first it is the knowledge which you understand that the red color of our blood belongs to oxyhemoglobin. Oxyhemoglobin gives our blood a red color. So, if there is arterial hyperemia and we notice that all the vessels, arterioles, the same as venules, dilate, so more blood volume comes to periphery, to the skin, for example. If you look at the right picture, you see that venous part of microcircularity has the same bright red color. Why? Because during arterial hyperemia, there is increased blood flow velocity. Increased blood flow velocity don't permit to tissue reabsorb more oxygen from the blood. And that is why the oxyhemoglobin appears in venous blood. This is another cause for redness. And the last will be increased number of functional capillaries. No, this is, I told you previously, this is the same information about the manifestation of arterial hyperemia. This is example, the picture which shows you which cell take part in acute inflammation if it will be in skin. Now you see, at first there is epidermis and then derma. You see? And the injury is damage the skin. But this in this wound you see a lot of neutrophils. Yeah, very many neutrophils here. Then there is damage of cells, this white. You see? There are not numerous monocyte macrophages here. And this green spot is, there is fibroblasts. For what it appears here? Now you understand that all the wound restored from periphery to the center. And this is the role of fibroblasts. Why fibroblasts increase their proliferation? Because macrophages, which come to the region of inflammation, release some enzyme as collagenase. Collagenase, breakdown of collagen, and there will be, after restore, absence of scar, but at the same time, collagenase is a growth factor for fibroblasts. What is the mechanism of arterial hyperemia in skin and mucous membrane? You know that in derma, deep layer of derma, there are very many receptors, but these receptors are in capsula. And there is only one type of receptors named as nociceptors, which is the free nerves ending, this one, free nerves ending. It comes to the border of epidermis and derma. So if there is injury in skin, there is activation of these nerves ending, and stimuli comes at first. This is the end of axon of the cells, which locates in spinal ganglion. And there may be the afferent fiber C or maybe A delta. So this axon has three branches. One of them comes to arteriola, another comes to precapillary sphincter, and the last comes to mast cells. After, from the end of these branches, release such neuropeptide, named as substance P. And all the effects of axon reflex is the effect of substance P. This is the effect of dilation of arteriola, increased number of functional capillaries, increased permeability, you see, and the degranulation of mast cells. When mast cells degranulate, in its granules there are mediators in ready form. That is why they name preformed mediators. They are histamine, heparin, proteases, and hemotactic factors for neutrophils, hemotactic factors for eosinophils. Immediately, when after degranulation, all these mediators appears in interstitial space. The question is, where are these mast cell locates? Mast cell locates in interstitial space, in connective tissue, near the venulus. What is the mechanism of increased permeability? Histamine, which release from granules of mast cell after its degranulation, comes inside the vessel and binds to H1 histamine receptors, which locates on endothelial cells. Now, this is the membrane of wall vessels. Endothelial cells, black is basal membrane, and then smooth muscle wall of vessels. After this connection of histamine with its own receptor, endothelial cells activates and change their shape. So it is not swallow of endothelial cell, it is activated of them. Because you know that H1 histamine receptors activate guanylate cyclase, and this will lead to increased cyclic guanosine monophosphate. That is why it will lead to increased calcium channel, and calcium in physiological concentration comes inside the cell. So this will lead to constriction of cytoskeleton in endothelial cells. That is why the endothelial cells change their shape. So activated endothelial cells can secrete mediators. At first, it can begin to synthesize them and then secrete. And there are only one mediator, which is in preform state in endothelial cells. It is nitric oxide. So endothelial cells release nitric oxide. It will comes out and influence on the smooth muscle. Smooth muscle dilate. So the complication of it will be increase the gap between endothelial cells. The first, the second, there will be further dilation of vessels. Complication of all these will be increased permeability. You see how can, this is the graph which show you that in increased permeability, you can find two stages. How can they find it? You see, intravenous, they inject the color. This color can binds to albumins, and further they look what will be after injury. During 30 minutes after injury, there appears the bluish spot surrounding the zone of injury. Then this color of blue begin lighter, lighter and lighter, but not disappears. And after 2 hours, there is intensive or bluish color increases and stay up to the end of inflammation. Look here. During the maybe several days. You see, the first stage, due to its time period, belong to arterial hyperemia. Venous hyperemia or congestion appears after 2 hours. And the next picture shows you the mediators which take part in the first stage of increasing permeability and during the second stage of increasing permeability. Wait, if you pay attention to mediators which appears in the first stage of increased permeability, you see all of them are preformed mediators except one, platelet activation factor, this one, because it is new synthesized mediator, but it needs 15 minutes for its synthesis, and that is why it takes part in increased permeability in the first stage. Concerning the second stage, all these, except bradykinin, all these mediators are metabolites of arachidonic acid, and for its synthesis need 2 hours. See? As for bradykinin, bradykinin finished its synthesis after 40 minutes. That is why it is not take part in the second stage. Yes, but its effect begin earlier in the time period between arterial and venous hyperemia. Now, what about this time period, which is before arterial hyperemia turn into venous one? Why it appears? Now, due to several processes which appears in blood in this period. You see, increased permeability, which appears in arterial hyperemia. It is increased more and more due to effect of mediators. Further, there will be dilation of vessels, both vessels, arterial and venous. And if that's so, blood flow velocity decreases. If that's so, why decreases? Because there appears microthrombus, there appears adhesion of leukocytes, and this will lead to changes the character of blood flow, appears turbulent blood flow. And we know if the blood flow velocity decreases, viscosity must be increased. Increase of viscosity will be due to increased fibrinogen in blood, increased a lot of microthrombus due to activation of clotting system. There appears the sludge phenomenon of erythrocyte, which decrease blood flow velocity more and more, and may lead to thrombus in any vessel, you see. And all of them increase exudate, and these increased exudate pressed on lymphatic flow and decreased blood flow, lymph flow, the same as venous flow in small capillaries. And that is why there appears congestion. Now, this is the sign of venous hyperemia. This is approximately the same as I told you previously, except one. There is such sign as cyanosis. What is this cyanosis? It is bluish color of skin and mucous membrane. Why it appears? You must understand that bluish color appears due to increased concentration of restored hemoglobin. this is restored hemoglobin, is binds to hemoglobin hydrogen ions. Why it appears? When there is decreased blood flow velocity, the extraction of oxygen from erythrocyte, from hemoglobin to tissue, increases. And in opposite reaction, the carbon dioxide returned back from the tissue to erythrocyte. In erythrocyte, there are a lot of water, and that is why there appears carbonic acid. Carbonic acid dissociates quicker to hydrogen ions plus bicarbonate. Bicarbonate shift from erythrocyte to the blood, because bicarbonate is the main buffer in our blood. In erythrocyte stay hydrogen ions. These hydrogen ions binds to hemoglobin, and there appears restored hemoglobin, which has a bluish color. If concentration of restored hemoglobin will be higher than 50%, we can see bluish color on the skin and mucous membrane. Now, all the other we discussed previously. Now, this is picture which show you all the events of inflammation. You see the initial stage of increased permeability. Look here, there is the small gap between endothelial cells, and that is why only plasma proteins and plasma comes out from the vessels. But you see the work of proteases damage the plasma membrane. You see what effect of mast cells there on the endothelial cell, on plasma membrane there, and these will, the same as here, appears hemotactic factors for neutrophils. That is why neutrophils comes out from the vessels into interstitial space. This is active effect. You see, if the basal membrane and the gaps between endothelial cells appears larger, you see, there will be passively outcome of erythrocyte to interstitial space. No, that is why there appears what? There appears the different types of exudates. No, serose exudate. It is light fluid, no, with a lot of leukocyte and proteins. You see the pH of this one. Look, pH in exudate is acidic. In serose, it is decreased. Normal, you know, pH is 7.35 up to 7.45. So it is decreases, you see. But if it is purulent exudate, the acidity will be severe. High concentration of proteins, fibrins, and neutrophils here. and the mechanism of appearance of exudate is increased permeability in the region of inflammation. There is another pathological process which named transudate. Transudate is non-inflammatory fluid which appears not during inflammation but during any other pathological process. For example, if the patient has heart failure, the work of heart as a pump is decreased. That is why in lower extremities you find edema. This is due to transudate, which appears if there is increased hydrostatic pressure in the tissue, in the vessels, and further it made this fluid to comes out from the vessels into interstitial space. What about the role of exudate in the zone of inflammation? No, it may be adaptive or pathogenic. Now, what will be adaptive? Now, you see that in fluid which are in interstitial space, it is easier for mediators which appears released from the cells transport to the region of inflammation. The same concerning immunoglobulins, you see. Then there is, if there appears exudate, it will lead to localization of inflammatory zone. You see, don't permit to toxic proteins which appears in injurious cells release in the bloodstream of all organism and spread all over the organism. It is the adaptive effect of exudates. But pathogenic is because if these edema appears in the organs and tissue which is very important for our organism. For example, brain or thorax. This may lead to the situation for organism which may lead to the death. Another one. Sometimes these exudate comes from the region of inflammation in capacity of our organism. Now, for example, ascites, you know, this is a fluid in the abdomen cavity, clear. And this will lead to what? To suppress, to remove from its own position the organs belong to gastrointestinal tract, the same as liver, intestine, the spleen, and so on. Further, it can lead to abscesses, you see, and that is why it may this may lead to negative complication of exudate. Это мы уже посмотрели. And before we face to mechanism of pain, we mixed the signs of inflammation such as local heat. And this is the questions from your colloquium. So if you touch the region of inflammation, you will feel that there will be the skin, for example, more warmer than the skin which is out of the region of inflammation. Why? No, it is mechanism of it will be arterial hyperemia. Why? Because we told that in arterial hyperemia, blood flow velocity is increased. We know that the temperature of blood inside the organism inside is 1 degree higher than the blood temperature in the vessels, in peripheral vessels. That is why if blood flow velocity increase, this hot blood quicker comes to the vessels on periphery, and that is why we feel the local heat. As for mechanism of pain, which is another signs of inflammation, they are the effect of mediators on nociceptors. They are histamine, bradykinin, substance P, adenosine, nitric oxide. On periphery, there may be serotonin. As for ions, they will be potassium and hydrogen ions, which lead to depolarization of nociceptors. This is the factors which lead to degranulation of mast cell, because you understand that, and we discussed it, one of the reformed mediators, the main mediator is histamine, which locates in granules of mast cell. No, this is all these chemicals are binding, has its own, except physical stimuli, has its own receptor on the surface of mast cell, and there will be activation of guanylate cyclase, and this will lead to the granulation of. What this is the mast cells inside the picture. On the left, there is preformed mediators, which release after degranulation of mast cell and lead to immediate earlier response. And on the right, there is the effect of degranulation of mast cells, which can synthesize new mediators, such as metabolites of arachidonic acid. You see? No, and further, there will be the information about the mediators. As I told you, that the most frequent effect in acute inflammation belong to histamine. And you see that there are histamine 1 receptors and histamine 2 receptors. They have separate effects. No, sometimes on some cells there may be both receptors, H1 and H2. I told you that preformed mediators which appears from muscles is protease. Proteases consist of tryptase and hemase. What they can do, due to its name, they break down the proteins. At first, there will be break down the basal membrane, and the complication of it will be increased permeability. In basal membrane consists of catalases and elastase. Yeah? Such fibers consist of proteins. You see, this is the effect of proteases of increased permeability. Another very important effect is proteases will clean the zone of inflammation of damaged cells, you see, and damaged tissue. And another one, it will activate growth factors, the same as growth factor for fibroblast, to increase restoration. Это мы пропустим. Serotonin. What you must remember, and very frequent you make mistakes. Serotonin is not in granules of mast cell. It appears, it is preformed mediators in platelets, in granules of platelets. You know that endothelial cells secretes platelet activation factor. This will influence on inactive platelets. It's turn their shape and begin to degranulate. And from its granules release serotonin. Effect of serotonin. At first it increased permeability. You see, increased permeability. Another very important, it will lead to spasm of venulus. If there is spasm of venulus, what do you think? There will be the complication of it lead to stoppage or impaired of venous blood flow. You see, it is clear. And it will activate nociceptors, and on periphery it will lead to pain sensation. But you see, serotonin in brain work as anti-nociceptive chemicals, mediators. Bradykinin, very important mediator, which has very severe effect. You see, and we told that Hagemann factor is the initial effect for appears bradykinin. What is the causes which lead to activation of Hagemann factor? Hagemann factor, this protein, swim in blood. So it will be activated by contact with not smooth surface, or maybe urea crystals or with a collagen contact. You see, what, if there is increased permeability and appears the retraction of endothelial cells, we find that there appears free collagen, which make the contact plasma with collagen, Hodgman factor with collagen, and Hodgman factor activated and binds to prekallikrein. It is inactive enzyme which is in blood too. After this contact, this inactive enzyme turn into active one, kallikrein, active enzyme. And this active enzyme influence on the alpha-2 globulin. Look here. This large protein, alpha-2 globulin, and this red color piece of it cut from this alpha-2 globulin by active enzyme. This piece of amino acid consists of 10 amino acids. After one amino acid removed from this appears bradykinin, which consists of 9 amino acids. The effect of bradykinin are the same which has histamine, but in several times higher, severe. Now, as for example, histamine influence on nociceptors and lead to irritation of skin, irritation of nociceptors. The effect of bradykinin lead to severe pain sensation. Another one, bradykinin can lead to spasm of smooth muscle in bronchi. You see? No, as histamine, bradykinin can increase permeability of the vessels, but not during 30 minutes as histamine, but for prolonged time. I told you about this platelet activation factor. No, due to its name, you understand it is the main effect of it will be activation of platelets. This mediator appears from phospholipids, you see, and that is why it can be synthesized by very many cells, you see, neutrophils, basophils, monocytes, macrophages, mast cells, endothelial cells, and so on. You see? Yeah. What its effect except activation of platelets? It can increase permeability, I told you previously. Further, it can lead to constriction of smooth muscle, you see, and it works as a hemoattractant for neutrophils. This is effect against them, its effect on platelets. No, this is about complement. We told about this. I showed you this picture you previously. And you know that activation of a complement system lead to appears the membrane attack complex. You see what this one, yeah, from this one. Yeah, the tube with the channel inside consists of proteins C5b, 6, 7, 8, 9. Yeah, that is why appears the tube in the protein content channel, so it will be hydrophilic, and this will lead to irreversible cellular membrane. No, except membrane attack complex, you see, there are the function of all component of complement. You see, now what I told you once, that C3A and C5A may lead to degranulation of mast cell. The first. The second, it can increase permeability. As for C3B, it will be opsonin. But you must remember this, the main one. C5A work as a power hemoattractant. This is the picture which show you all formation of metabolites of arachidonic acid. But you must understand that arachidonic acids are in the tails of phospholipids. So after increased calcium in the cell, calcium will activate membrane binding phospholipases. See, these membrane binding phospholipases, what especially phospholipase A2. What does it mean? It will cut down from the tails arachidonic acid. That is why this order of phospholipids, you see, break down, and you see what will be in the phospholipid layer. Arachidonic acid drops from phospholipids in the cytoplasm, where there are two enzymes, cyclooxygenase and lipoxygenase. And that is why appears the metabolites. In cyclooxygenase pathway, they appears the prostaglandin, prostaglandin E2, prostaglandin F2 alpha, prostaglandin G2, prostaglandin A2. Now, prostaglandin, there appears A2, breakdown quicker, it is here, yeah, and there appears thromboxane. As for work and complication of lipoxygenase, you see, there appears leukotrienes. No, it is very clear to understand them due to alphabet. You see, leukotriene A4, leukotriene B4, C4, G4. You see what they are. The metabolites of arachidonic acid. Know what cyclooxygenase, its effect, and there are two isoforms of cyclooxygenase. We will пропустим это, and there will be the mechanism of or effects of prostaglandins. And this is the question in some cases which you will receive in colloquium. And so, значит, prostaglandin E2, it will lead to dilation of vessels and increased permeability. Bronchodilation, you see, because one of prostaglandin, yeah, for example, D2 and F2 alpha, lead to bronchoconstriction. A prostaglandin E2 can lead to bronchodilation. And what does it mean? Sensitization of nociceptors means it may lead to or decreased excitability of nociceptors, or opposite, increase them. You see? As for prostaglandin D2, lead to increased permeability. You see, it is then it will increase function of leukocytes, means increase phagocytosis. You understand? Then it will lead to activation of platelets. No, as I told you about prostaglandin F2 alpha, I told you about that this will lead to bronchodilation, bronchoconstriction, and it will lead to degranulation of mast cell. Prostaglandin F2 alpha. Now, as for thromboxane, you understand, this will bronchoconstriction, and it will decrease lumen of all vessels, arterioles and venous, and it will lead to increased adhesion and aggregation of platelets. This is its main effect. And it will, this is the one of the first stage of phagocytosis. It will increase adhesion neutrophils to endothelial cells, means increased expression of adhesion molecules on endothelial cells, and the same on the surface of neutrophils. As for leukotrienes, I told you that approximately all of them increase permeability except one, leukotriene B4. Leukotriene B4 is the power hemotactic factors for leukocyte. Hemoattractant is. And further, it increased activity of nature killer. As for leukotriene C4, D4, E4, which name as slow reaction substances for anaphylaxia. The mix of these three leukotrienes lead to bronchospasm, very severe effect, and they lead to dilation and increased permeability of the vessels. Another negative effect is that it will lead to spasm of coronary arterial. Means that this may lead to impaired of coronary blood flow, and this will lead to heart failure. Another effect is it will stimulate releasing of acids, chloride acid secretion in stomach, means increased acidity, and complication of it may lead to appears the ulcer. And this is a very important picture for you. Means you must know how to treat inflammation. You see, and as usual, they told you that if there is any inflammatory process, the doctor will recommend to intake non-steroid anti-inflammatory drugs. This is type of aspirin. Aspirin is a non-steroid anti-inflammatory drug. Its effect is blockage cyclooxygenase, this mediator. If that's so, there will be absence of synthesis prostaglandins and thromboxane, both disappeared, synthesis. But if there is severe inflammation, except this, which is green picture here, appears there or stay intact the leukotrienes, which is the effect of lipoxygenase work. So, if there is severe inflammation, they used the steroids drugs, such as glucocorticoids. Значит, glucocorticoids will block phospholipase A2. That is why there will be absence of appears arachidonic acid in cytoplasm, and that is why there will be blocks of work. No, if there is absence of arachidonic acid, no metabolites from arachidonic acid appears. No absence of prostaglandins and thromboxane, the same as absence of leukotrienes. You must remember about it. And at last, there will be some words about the chronic inflammation. No, at first, when there appears chronic inflammation, the causes, no, it may be what? Persistent infection or severe infection. For example, the tuberculosis, you see? Then hypersensitivity disease, yeah, means immune-mediated inflammation, because you know it may lead to chronic inflammation. All the immune diseases can realize through inflammation. Then effect of toxic agent. Toxic agent can have acute effect or prolonged effect. What else? There may be appears chronic inflammation if there appears the defect of macrophages. Defect of macrophages. You see, name as incomplete phagocytosis. You see, when it will be. Now, if, for example, some infection agent has very stuck the capsule and it cannot be destroyed by the enzymes and which appears inside of phagosoma. This is the first. The second, about defect of macrophages. You see, some macrophages can, due to mutation of genes, has very severe mediators which can damage, or absent these mediators, which damage some infectious agent. You see, what all these may lead to chronic inflammation. What is the mechanism? No, I told you approximately. Unsuccessful effect of inflammatory response. If there is several times influence, the same infectious agent, or there may be uncompleted phagocytosis, you see, or what I told you about, some microorganism which will be not damaged inside the phagosome and stay inside of it, then proliferate inside and further damage the phagocyte. No, for example, tuberculosis. You see, this bacteria can stay inside the phagosoma for prolonged time, and these form such the specific type of chronic inflammation as granuloma. You see, you have the case with the patient with granuloma, with tuberculosis. You see, in this case, some macrophages differentiate into epileptoid cells. This is increased in volume phagocyte, and this phagocyte cannot work as phagocyte, you see, but because it cannot move, you see, but some small particles it can absorb and neutralize. The other type of macrophages can turn into or can bind to the other macrophages, and that is why there appears the multinucleate cells. Now you understand, there will be the cell which has the very large volume, named as giant cells. These cells can active as phagocytes. What? In this, in granuloma, as I told you, granulomatous inflammation is a form of chronic inflammation. What you see here, the causes of these mycobacteria, you see, I told you about tuberculosis, you see, then there will be such disease as lepra, brucellosis, syphilis, so on, you see, and which cell can form to and take part in form of granuloma. You see, inside of granuloma, there are the dead cells. You see, dead cells, this orange part of. Then it is epithelioid cells. What these look like the surrounded this orange one from the left part of this picture. Then there appears the giant cell, you see? And surrounded all these will be lymphocytes. And after the outside of lymphocyte, there will be the fibrous layer. Well, this is the picture of tuberculosis granuloma. Now you have one case where they ask you about the content of granuloma and the causes of chronic inflammation. Well, the lecture is over. That is why I thank you for your attention, and goodbye, my dear. See you in seminar.
Thank you. Goodbye, teacher.
Сколько там? Not so, 13 persons stay at the end of the lecture. No, it is good. Goodbye. Thank you. Что это такое? Неправильно. Почему не может открыть? Зараза. Слайдов-то нет. Ничего не понимаю. Ничего не понимаю. Просто. Хорошо, этот компьютер. Давай. Так. Вот. Я ничего не понимаю просто. Так, хорошо, давай возьмем этот компьютер. Так. Хорошо. Давай возьмем рабочий стол. Документы. Угу. Так.